Okay, so I have 1:15 straight up, so we will go ahead and get going. Welcome everybody to our weekly or bi-weekly, I hesitate to say that word again, but every 2 weeks news conference now regarding the COVID-19 pandemic in the city of Bloomington, Monroe County, Indiana University, and Indiana University Health. I'm Chuck Carney, Director of Media Relations for Indiana University. We'll begin with opening comments first from Bloomington Mayor John Hamilton.
Thanks a lot. Good to be with you again. Very quickly, the regular updates. We did have one more new case among employees, positive case this week. That's been the pattern over the last several weeks. I do want to note that the City of Bloomington Utilities wastewater testing did show some increases this past week. November 1 testing at the Dillman wastewater plant went up to 23 RNA copies per 100 milliliters. That's the technical measure. 10 has been the detect limit, and we're now at 23 there. In Blucher Pool on the north side, which actually encompasses more of the northeast side of the city, up to 85 counts per 100 milliliters. So those are not as high as we've ever seen, but they are a tick up in watching the copies of the COVID genes in the wastewater. Just under 70% of our employees, just a tick under 70% of our employees have now demonstrated their positive vaccination status to us. So that number continues to go up a bit, which we're pleased with. We want to keep it going up. We've seen a long, slow improvement locally and statewide in cases and deaths and hospitalizations over the past 6 or 8 weeks. However, there are little tick ups in some of these measures that I just mentioned, as well as I know you'll hear from county and slight indicators that are cause for concern, both locally and statewide, particularly with colder weather, holidays approaching. Yes, it's why we keep watching these numbers. It's why we have to keep moving ahead with vaccinations, including now for the qualifying younger residents of our community, and why boosters and flu vaccines and masking and protocols are still important. Long and steady progress over the last 6 or 8 weeks, but little indicators that say we are definitely not out of the woods. We got to keep watching and keep wary and doing what we're doing. Lastly, let me just mention, there were National Occupational Safety and Health Administration, OSHA, rules published effective just today. We are still evaluating the implications of those, but let me just share some basics of that. They are very significant for large employers, including the city, which is covered, that make us take some steps in the next 30 and 60 days. Under this safety standard, again, which was published effective today, all city employees by January 4th must either be vaccinated, demonstrate their vaccination status, or get weekly COVID testing and have significant masking protocols consistently at work. The city, as one of these employers, we are evaluating our options and planning to achieve those. And I just want to note, these are not optional requirements. These are safety requirements. They're not advisory, they're not optional, they are safety requirements designed to protect the safety of everyone, just like OSHA requirements on workplace air quality or safety equipment or machinery standards or others, meant to protect the safety of employees and the community at large. We will continue to evaluate the details, and there'll be more to come on this, but I just want to close by noting I think this is a very good and important step of setting national standards for what is a national health emergency to help us recover as quickly as we can. It also helps level the playing field among all large employers, all the employees, assuring fairness and consistency, and not having some of the stress and difficulty for that. So I'm pleased that these are available. We will be studying their direct impact on us in the days and weeks ahead. But those national safety standards, that's a really important big step that does apply to city employees. And I'm happy to take questions. Back to you, Chuck.
All right, thanks, Mayor Hamilton. Let's next go to the Monroe County Department of Health and Penny Caudill.
Good afternoon. This week, as was mentioned, our 5 to 11-year-olds became eligible for vaccination with the Pfizer vaccine, and we are seeing lots of eager people ready to get their children vaccinated so that they can ease their concerns over illness and quarantine. So interest with the booster doses that has been available over the last few months, and now the newly eligible group, has certainly increased the pressure on our vaccination system. So I just ask that everybody do remain patient. We will get you vaccinated. For the 5 to 11-year-olds, we are again partnering with our area schools to make vaccinations easy. So we will have 2 super shot days, one on Thursday, November 18th from 4 to 7 at Edgewood Primary School gym, and on Saturday, November 20th from 8 to 2 at Bloomington High School South Cafeteria. Now, you register for those just like you will register for any other vaccine. It will be ourshot.in.gov. At this time, we don't believe that registration has opened. The state is opening registration as vaccine is delivered and available for certain clinics. So if you are an anxious parent waiting to get that appointment, please, again, be patient, keep checking in. I believe it should be live no later than Tuesday, but we are checking on that. And as soon as we know that it is, we will make sure the schools are aware of that as well. Both of those clinics are available for any 5 to 11-year-old, regardless of what school system they live in or where they go to school. We want to make it convenient. It was easy to partner with our school systems. The second doses will be held in December on the 9th and 11th, respectively. So again, go to ourshot.in.gov. You can see all of your vaccine options. Our nurses have been doing flu clinics in the schools, and they are finishing those up. And then we will turn around and start on-site school clinics for these 5 to 11-year-olds as well. So for those who can get started on their vaccines soon, or by the time that we do these big shot days, you'll be can be fully vaccinated by Christmas, right? Just barely, but by Christmas, you could be fully vaccinated. Those who are getting vaccinated in the schools on-site clinics, some of those won't actually reach fully vaccinated status until early January, because again, there are a lot of schools to cover, and it will take us a little bit of time to do that. But that is certainly an easy way for parents to get their children vaccinated. We've also requested a mobile clinic, and that should come, I think, the week of the 17th. We're waiting on confirmation of that. And of course, that will have vaccine for all age groups. So anybody can go and get vaccinated or get their booster dose of vaccine as well. And testing will be available at that mobile clinic too. Pharmacies are also an option, but pharmacies, our public health clinic, private providers, everybody is starting out with a little bit of vaccine, and it will start flowing more. But initially, the state wanted to get a little out to as many people as possible and then increase the flow of that. So I can't stress enough being patient. For those who have questions about their children and vaccine, I have been referring them to the Ask Aaron that was done this week. So I'm so glad that Dr. Carroll is with us today. And I know the link to that will be shared shortly. So I encourage you as a parent to take this opportunity. If you're having to wait a few days or a couple of weeks to get that vaccine, take this time to get your questions answered. In terms of testing, there's still testing options available. Coronavirus.in.gov will provide you with the most up-to-date list of testing sites. And a reminder about the Gravity site on Cook property. When you go to that map, the first thing you're going to see when you look on Monroe County is you will see Cook property listed. And when you click on that, then it will tell you that that is the Gravity site. So sometimes that's created confusion for people. No appointment is necessary. It is still an outside drive-through clinic with plans to go indoors. So I'm anxiously awaiting where and when that will happen. We will share that as soon as we have it. If you happen to arrive between 8 and 4, which is their normal hours, and they appear not to be open, then I would say check the weather around you. If it's storming, they may have had to close for a while. If it is a short-term weather event, they will reopen. If it seems to be the storm is going to last the rest of the day, then they may close for the rest of the day. So I know that that can be inconvenient when you're wanting and needing a test right away. But just keep that in mind, and they should be indoors soon. This week, our community transmission remains substantial. This week, our weekly cases rose to 121 per 100,000 residents, and our positivity rate was at 3.37. This does put us in a full yellow advisory status. That means that our Monroe County regulations for masks in public places remains in effect. It will be in effect for a minimum of 2 more weeks and probably several weeks beyond. I will take this moment to stress the importance of being vaccinated and to follow mask regulations, to follow isolation and quarantine requirements, test as needed, and maintain all the precautions that we've been taking these past 2 years. Flu season is here, and all of these steps also help keep influenza at bay as well. So as we come to a time of giving, I would request that we not give each other infections, be they the flu, COVID, or any other respiratory infection. Instead, let's give all of our efforts to giving grace and being kind, get vaccinated, follow regulations and recommendations to reduce transmission. We will get through this. Thanks, Chuck.
There are other gift ideas, certainly. Next, go to Monroe County Commissioners and Julie Thomas.
Good afternoon, Chuck. Good afternoon, everyone. Thank you for joining us today. Always appreciate being able to share information. I'm going to remind Monroe County residents again that the Board of Commissioners and the County Council have worked together to create the Township Assistance Fund. This is specifically designed to help folks who are struggling in the community with basic necessities, things like rent and utilities. And this is a fund being administered by the Township trustees. Contact your trustee as soon as possible if you are struggling to meet basic needs. And every Monroe County resident, whether they live in the city, a town, or neither, lives in a township. And you can find your township trustee by calling 211 or going to in211.org. That Township Assistance Fund will be available at least through the end of November. I also want to remind folks that we do offer a service for all Monroe County residents. Every Monroe County resident is encouraged to sign up for the Resident Alert Program. Just go to co.monroe.in.us and click on the megaphone. You will find that the health information on children's vaccines was posted this week, and as all health orders are. But also there will be information that you may need for travel or if there's an issue related to storms. So please go and sign up for the Resident Alert Program. You can receive alerts by text, phone, or email, or any combination you choose to be very well informed for the future. And I appreciate what Ms. Caudill said about everybody being kind and respectful. That's such an important thing, not just at the holidays, but throughout the year. We really need to keep working together. We had this glimmer of hope when we were looking like we might be in the blue, and we've missed that barely, but we're now moving indoors more. Weather's colder for sure, and we all need to take care of one another, take care of our families, take care of ourselves, and the best way to do that is to get vaccinated. I got my booster shot today, so I'm very happy about that. And for those of you who need it, you can go to the same site and get your appointment scheduled. So with that, I will take questions. Thank you.
Okay, so next check in with IU Health and Brian Shockney.
Thank you. I want to thank everyone who has been getting their flu shots. We've had good uptake and continue to see good uptake. Thank you for doing your part in protecting our community and making us healthier. While we're seeing a steeper decrease in our COVID-19 patients, it continues to be this slow decline. As you can see on this slide, and the same story for Monroe County. Good news that it's continuing to decline, but it is going slower, and I just cannot say more than what's already been said about we're in this point where we're seeing going indoors, and we just need to be careful. So let's talk a little bit about the flu. The one thing that really helped the healthcare system last year during the winter COVID surge was we had very low number of inpatient flu cases. And the reason being is we were wearing masks, we were socially distancing, we were taking care of each other, as the commissioner said. The CDC reported that 2021 hospitalization rate was the lowest since the CDC had been collecting all hospitalization data beginning in 2005. So the low rate of flu can be attributed to those great practices. And unfortunately, we have been tracking daily and weekly our flu admissions, and it is not a good sign. We currently are seeing higher numbers of inpatient flu cases in our South Central Region hospitals above our 2019 level season, which was a high season and prior to the pandemic. So thank you for those who are getting your flu shots. Thank you for parents who are getting their kids flu vaccinations. We can't be more proud of what you're doing and careful in protecting all of us. The best way to protect yourself against flu and COVID-19 is that vaccination. So let's talk about those vaccinations. We are excited for the CDC approval of Pfizer COVID-19 vaccine for children's age 5 to 11. This is especially important after the summer surge of COVID-19 cases in children. As you all know, we have IU Health Riley Children's Hospital, and we saw during this past surge more infected cases of children and higher admissions and sicker patients who were of those younger ages than we had seen since this pandemic began. As Penny mentioned, we're happy to continue to have a partner in the Monroe County Health Department and our commissioners and everyone to be able to give these vaccines. And on this graphic, you can see where these vaccinations will be provided. As we discovered when our adult vaccines were delivered, the group vaccination sites are the most efficient and effective way for us to deliver vaccines to our patients. Therefore, we strongly encourage you to utilize the vaccine sites and opportunities for getting your children vaccinated along with your personal COVID vaccine and booster. Our physician officers are working very hard to care for our patients that had put off their visits and care during this pandemic. And these group or large flu vaccination sites really help us so that we can continue to care for those patients who need us and need those clinic visits and not take away from those patients getting in. So please utilize those sites, utilize those ability to go on and get scheduled at those large vaccination sites. And finally, please continue to encourage your children to keep wearing masks, social distancing, and washing their hands regularly. After they get that vaccine, there is a period of time, just like with us adults, that they have to build that immunity up. So that vaccine is not an end-all be-all until that immunity has built up into their system. So thank you again for all that you're doing to protect our community, and I'm happy to take questions at the end.
Okay, we'll check in with our Indiana University tag team. We'll start with Kirk White.
Good afternoon, everyone. Looking at our numbers this week, our vaccination rate continues to increase just a bit. We went up 0.2% to 94.3 this week, and our cases have ticked up just a little from last week. Kind of following the theme that we've heard about today, we had 26 cases this past week. 21 of those were students and 5 were faculty and staff. This is still a very low number, reminding you that our high number was back on September the 3rd when we were at 91 cases. So all through October, we've stayed in the 20s. but we saw just a little bit of an uptick this week. So we need to be mindful of that and continue our efforts. I want to also talk about our flu clinic. Lots of discussion about how influenza is increasing in the community. It is on the campus. We're starting to see some additional cases at our student health center. And again, we'll be having a flu shot clinic this Sunday from 12 to 5 at Simon Scott Assembly Hall. And in addition to the flu vaccine that you can get there, and I just put the information in the chat, we'll also have the Moderna vaccine available this Sunday at Assembly Hall as well. And also at that site where that link is, you can see where the flu clinic, vaccine clinics are at our other campuses around the state as well. And then finally, I'll put the link in for the Ask Aaron seminar before Dr. Carroll comes on Wednesday. Of course, the main topic of that seminar was the vaccine for children and how it had been approved. And if you want to see that webinar again, there's the link. It's still available for folks to access. That's our report for today. Ready for any questions?
Yeah, and so turn it over to Aaron as well to comment on the developments. And again, that broadcast.iu.edu Ask Aaron link is there despite weak moderating. It was a good webinar. Aaron had good questions.
The moderating was fantastic. I disagree. I'm not sure I have too much to add above and beyond what's been said by many people before. We've been declining cases everywhere, but we have stalled in Indiana in the last week or so. I mean, if you just look at the slope of the graph, it's slowed, and everybody's feeling that. I think even on campus, we've seen a slight uptick in cases. Of course, we were low before that, so it still remains quite low. In general, certainly nothing like what we saw last year, but we'd all like to see cases continue to go down and Bloomington to get to the 50 cases per 100,000, which certainly is not going to happen this week. We continue to be concerned about flu. We're seeing more cases of flu. The vast majority of symptomatic tests that we do are not COVID, meaning that they're something else, RSV, flu, some other respiratory illness, which makes us happy about COVID, but we still don't want to be seeing so much respiratory illness. So we're still encouraging students, faculty, staff to stay home when they are ill, not to be around others, and to get tested and care for themselves appropriately. We still remain cautiously optimistic about how things are going. Vaccinations keep going up, which is great. We will, of course, have to work to meet all the new guidelines and rules that are coming out along with the rest of the country, but we're certainly working on that as well. Happy to take any questions.
Okay, and we are waiting for our first question, so I'll throw one out there to get us started. Penny, much discussion has been on the yellow level and how close we can get to blue, and when can we start taking off masks inside. You alluded to some of this, but you seem like you were cautioning that we are some ways away from actually making that change at this point.
We are. In terms of the advisory levels, remember that we have to see that downward trend to blue in our case for 2 weeks in a row before that advisory level will drop to blue. So you are looking at a minimum of 2 weeks before we get there. And the likelihood that we will drop below 50 cases per 100,000 in that same 2 weeks is pretty low. I can't say that it's impossible, but it's not likely. And the best way that we are going to get there is for everyone to be doing all the things that we keep talking about doing. And that's remaining cautious, again, not spreading infection by staying home when you're sick, or getting tested, getting vaccinated, wearing your mask. That's why we have the mask requirement. Is our cases per 100,000, we still have a high level of community spread. And until that drops and our risk is less, we need to be taking extra precautions.
Aaron, I'm going to come back to you. And again, if you have a question, happy to take it here, but I'll extend this for a moment so that you can formulate one. If you do have one, take that in the chat. Aaron, we talked on the webinar actually this week a lot about the new the new opening of the vaccine to ages 5 to 11. What is your best advice for those who still may have some questions in getting their child in that age group vaccinated right now? What should they personally do before making that call?
Well, I mean, the best thing to do is to get your concerns and questions addressed. One of the best ways to do that is to talk to your own healthcare provider, your pediatrician, or wherever you get pediatric care. One of the things that's going to be different in the rollout of vaccines for children, as opposed to the way we've been doing it elsewhere, is that many doses are being sent to pediatricians' offices so that they can give out the vaccine themselves. We've not made use of primary care physicians generally in the distribution of vaccines for the pandemic, but it's good to see that happen at least now. And since there's a lot of trust placed in children's healthcare providers, they're a phenomenal resource to address any concerns or questions you have. Otherwise, again, I still think there are other ways to get questions addressed. We hopefully did some of that on Wednesday's webinar, where we took a huge number of questions about the vaccine. My very quick summary is that lots of research has been done. These are safe and effective, incredibly safe. We'll be doing more monitoring as we move forward, but the harm of COVID is real, and the benefits and potential small, very, very small, if there, harms of vaccination have to be weighed against the very, very real risk of COVID. Thousands of children have been hospitalized. About half of hospitalized children wind up in the ICU. Lots of children still admitted to the hospital with MIS-C after they have gotten COVID. And of course, there's lots of illness that occurs without going to the hospitalization that can be avoided as well. Not to mention that almost all kids have people they love who are at high risk, whether they are elderly grandparents or people that they love who are immunocompromised or who have chronic conditions. Getting kids vaccinated to protect those around them is something we do all of the time. And as a pediatrician, it's something I push for all of the time. And so vaccinating your children not only protects them, and it really does protect them, it also protects those that they love around them. So, making the argument, I think it's something that absolutely everybody should do. It's been highly recommended by every major medical organization that I know. And while I understand that still certain parents are going to have questions and concerns, it's important that they go get them addressed and get good answers to those questions so that they can make the best decision for their children and for the rest of their families.
And there are a couple of links that we just shared in the chat on our newsroom.iu.edu site, news.iu.edu site, which these are questions that Dr. Carroll answers about vaccinating younger children and the COVID-19 vaccine for kids. Those are at our news.iu.edu site if you're watching on Facebook and can't get that link directly. Otherwise, it is in the chat. One more question as I extend this for a moment. Our reporters don't have any other questions. Brian, I saw some photos this morning of long lines for getting the vaccines for kids in some spots. Has that also been reflective of some of the IU health sites that you've seen? Do you sense that there is at least a surge right now in these early days of that vaccine opening up?
Yes, we are seeing a lot of phone calls, high volume, very high volume of phone calls to our pediatricians' offices. We will have the vaccine, as Dr. Carroll said, available for scheduled appointments. Again, we want the most efficient process and the quickest process, and that's going to be utilizing our partnership among those on the screen at the vaccination sites that you can schedule through myshot.in.gov, so we can get those in your kiddos quickly and get it documented. It'll go right into the database, a CHIRP database, so your doctor has a record of and your pediatrician has a record of their shot, and that's the best way to do that and get this quickly taken care of. Unlike the previous, where we had tens of thousands of patients who are eligible. This 5 to 11 category is a relatively small number of community members compared to what we had to who we had to vaccinate previously. So the need for day after day vaccination clinics and those kind of things just aren't there. That's why we're trying to concentrate them in these single day events where we can really get lots of shots in arms and be efficient with it. But yes, many of our sites will have vaccine, and as patients are already scheduled for their visits, our pediatricians are not only have been giving the flu shot and asking about that, but they will be giving the COVID-19 vaccine as well for those who wish to have it. So yes, there's a high demand and the phones are ringing off the hook, but we encourage you to utilize those shot clinics at the schools where we are all together and can quickly get your kiddos through.
Okay, and I'm reminded that if you don't see an appointment open, can't find one open, go to rshot.in.gov. Keep checking that site for more appointments that will come open as more shipments do arrive. So seeing no other questions, unless anyone has another comment to add, we will conclude it there. We will be back in 2 weeks with our next news conference regarding the COVID-19 pandemic locally. Until then, we will see you then.